Thank you, Minister. We now move to the official opposition. Mr. Harris.
Thank you. Good afternoon, Minister, Deputy, and staff. Look forward to our next 13 hours for as many as I'm going to be here for them. Got a couple different topics. I know we have 2 rotations. So, Minister, with me, you'll likely have, we'll start off with our rare disease community. I'm looking at a news release from your ministry on September 2nd, 2016, but you announced back in February of 2016 your intentions to strike a working group. Of course, that was in response to a select committee that I had proposed and debated in the legislature. Unfortunately, you and your government defeated that call for a select committee that would provide an opportunity for rare disease patients across the province in an open legislative format. We've had much success with those in the past on sexual harassment, developmental disabilities, mental health. You, of course, didn't move in that direction, unfortunately. But you did strike a working group that consisted of Dr. Ronald Cohn, a pediatrician-in-chief at the Hospital for Sick Children, Scott McIntaggart, Senior VP, University Health Network, led by those 2 folks, I believe, co-chaired by those 2 folks. Now, you had said here in your own bulletin, dated September 2nd, 2016, that that working group would submit an interim report in the fall of 2016. It's now October 2017. Where is the interim report that was due, or that you had said you would submit by the fall of 2016?
Well, thank you, and I appreciate the question, and I appreciate it more because I know this is an issue that's very important to you, and although we may at various stages differed slightly in terms of our approach, I would hope and I believe that we share the same goal with regards to improving and enhancing care and support and health care and access to medications for individuals with rare diseases. So the committee, the working group rather, that was established, and you're correct, it was co-chaired by Dr. Ronald Cohn, who's the pediatrician-in-chief at the Hospital for Sick Children, as well as Scott McIntaggart, who is the senior clinical vice president at UHN. Coincidentally, they met today, so we anticipate getting the final report of that working group in this fall, in the coming weeks. I am enthusiastically anticipating that report, and I, of course, will be happy to share it with you.
Yeah, good. So how many times roughly would they have met over the course of the last year or so? Was there a framework for meetings that they put up? I remember Dr. Ronald Cohn talking about, his participation in this working group, that he had no intentions of participating if it was going to be another exercise. I mean, I'll draw your attention back in the day to, I believe it was the Ontario, your government did a report, I believe, in 2010 on this as well, kind of sat on a shelf. And so here we are again with the working group. How many times have they, in fact, met since the striking of this working group?
Yeah, I can't speak to the exact number of times they've met, but I apologize, Chair. Yeah, this is Bob Bell, Deputy Minister of Health, Long-Term Care. So I can't give you the exact number of meetings. It's possible that may materialize while I'm talking from the group behind me. But I can tell you that I've spoken to Dr. Cohn on probably 5 or 6 occasions, that his interim report has been received by the ministry verbally, and his report has actually been supported by the Critical Care Services Ontario Secretariat. And what we do know is that they anticipate implementation around 3 individual working groups. These working groups will establish a hub and spoke care provision network for patients living with rare diseases in the province, develop a plan to improve access to novel genomic diagnostics, including whole exomal sequencing and whole genomic sequencing, which, as you know, is a methodology which has been really foundational work done by Dr. Steve Scherer at the Hospital for Sick Children, who's advised Dr. Cohn through this process. And as you also know, members from CHEO that established the Born Registry have been members of these of the steering committee, expert working group, and they have defined the specifications or requirements for a rare disease registry. So we're thinking that these three working groups will serve as the appropriate focus for implementation. We're particularly excited about the opportunity to develop genomic testing here. As you know, sometimes these patients present with symptoms that indicate extremely rare diseases that may be shared by, 10 people around the world. Families network around the various mutational elements that are diagnosed by whole genomic sequencing, and we hope to make that information available online so that parents can actually network in sharing their children's symptoms as time goes forward. So we're excited about the advice received, and we also have an implementation framework established through the Critical Care Services Secretariat that we think will not only help us get good advice from this group, but obviously implement it across the province as the key step.
So you've got, when do you expect, you're saying you received a verbal interim report, but when do you expect to actually receive a document from this working group?
I think I can speak to that.
Or have you already received an interim report? Because I believe I asked you a question in the legislature some time ago, and if I can recall, you may have even alluded to the fact that you had an interim report that you had read or viewed. You weren't too far off. So.
Yes. So, and this was a committee that was struck, I think, in fall of 2016, correct?
Yeah.
And so, indeed, we have received the report of the working group.
How long have you had that report?
We have had it for certainly several months.
How come you haven't released it? What's the holdup?
Well, part of it is technical, right? So part of it is we're reviewing the recommendations. As the deputy said, we are planning for implementation and to develop an implementation steering committee that, as referenced by the deputy, that will, since we take seriously this report, that we want to have an implementation strategy and be very deliberate in terms of a timetable and framework for implementation of the various recommendations.
Yeah, I know.
So in fact, so we anticipate in the coming few weeks, we should be able to, my understanding is it's being made AODA compliant, and we will be making available publicly in the coming weeks. But it will provide us with the opportunity, I think, to respond directly to the recommendations that are there, the work that we've been doing over the past months.
Just to be clear, I mean, the deputy said he had a verbal report, but you actually have a copy of the interim report, which in turn you hope to have or make public in the coming weeks.
And the other follow-up, Mr. Harris, is that the group met, the various subgroups met up to 8 times over the course of the year. Okay,
that's good. So I'll await that, I suppose. I mean, I guess I'd ask that the report be tabled with the committee or submitted to the committee, but I'll hold you to the fact that, you're going to release that in some sort of public way within the next few weeks because, we were expecting that, obviously, in the fall of 2016. We're now fall 2017, and you, of course, know what's happening next spring. These folks continue to wait, of course. On that note, much to do with the rare disease community is the backlog or the pipeline. And we're going to get into OHIP Plus perhaps later on, but yep. You know what, the regulatory process for approval of treatments in Ontario is frankly extremely painful. You know what, we're going to maybe get into some PCPA stuff, and I think I see Sue in the back there, and I know you'll maybe want to come up and join us, but, Minister, do you feel my frustration and perhaps others' frustration with the process over at, you've got Health Canada, you've got CADITH. It goes over to, in some cases, and I'm going to bring up this new acronym for cancer drugs, but the PCPA, just a gridlock. You think the 401 is bad on a rush hour morning? I mean, PCPA is frankly an embarrassment. The process. I mean, only a few years ago, I read about 167 days to get an approval. We're up to about 341 now. I mean, Minister, what would you say to the reason why we're now over 300 and some days before we see approvals? I mean, do you share my frustration with this regulatory process?
Well, I do and I don't. So I agree in the sense that it can be made better. The federal government has committed, and we're working together with them to this end, to better coordinate and streamline our two processes: the approval and licensure process that Health Canada is responsible for, which is in many ways substantially different than the process that the provinces and territories go through when they make a decision based on evidence and science and efficacy and evidence of improved outcomes when they review drugs that have been approved for licensure in Canada. That next step is up to the provinces and territories, but the more we can coordinate and indeed probably overlap those processes, and that's the work that we're doing, I think that will be an improvement. So I agree in that respect. But where I perhaps am more optimistic than you are, if you'll allow me, is that when we look at the present day reality compared to prior to the PCPA, there have been enormous improvements in a variety of channels. We've so far 288 brand products have been reviewed and supported by the PCPA since 2010, and 587 generic products have been submitted to the centralized price confirmation process as of this past June. And whereas we had tremendous disparity, and all of these, I mentioned Health Canada and the provinces, but all of the provinces and territories sort of having their own system of approach and approvals in helping them decide whether to add or not a particular drug to their formulary. We now have a consolidated national integrated approach, which I agree with you, can always be improved. We can, and we are.
You'd think though, by consolidating the provinces to one negotiation scheme through the PCPA, you'd actually, think you'd decrease times. I mean, since 2015, though, as I said, 167 days from CADITH recommendation to complete a negotiation over at PCPA. Now, 2017, over 300 days. Tell me this, and Sue, you'll probably know better than most. How many how many negotiations were completed in 2017?
Sure.
How many?
So, Madam Speaker, Suzanne McGurn, Assistant Deputy Minister and Executive Officer for the Ontario Public Drug Program. Thank you very much for the question. And maybe just to make an introductory comment, I think it's important to recognize that just over the period of time of the last 2 years, the actual volume of medicines that are proceeding through have grown exponentially. Just to reiterate, 288 brand products have been reviewed by the PCPA since 2010 up to June 2017, with approximately 50% of that activity in the last fiscal year, 16-17, and that volume continuing. So for recognition that there has been a significant change in volume, it's not slowing down of the process, it is volume related. Specifically with regard to timelines, I would just comment that the average timeline, and there is quite a range. We have had files closed in as little as 0.2 of a month, so a couple of weeks, to 29 months, with the median being 9 months and the average being 8 months. That's the actual negotiations.
So how many files did you close in 2017?
I don't have 2017 hold, but I can bring that number back to you.
What about fiscal 2016?
So we have had in total, in fiscal year 16, 17, sorry, I don't, 50 files within HTA were closed by the PCPA,
50 files closed.
closed.
So how many of those, I guess, what is the outcome? What are the options for outcomes? Negative, positive, what is the terminology you would use?
So there's a variety of ways, there's a variety of things that can happen. So the PCPA makes a decision to negotiate through the PCPA with the involved jurisdictions. They take into account advice they are given, particularly from CADIF, and it can be PCODR for the cancer drugs, or it can be CDR for the non-cancer drugs, and as well, Quebec is involved in PCPA now, which means that we also take into account the recommendations from INES, which is the equivalent.
But what's the actual outcome?
So the actual outcomes of the negotiations can be varied. I'll try and do them off the top of my head. So you can negotiate and get an agreement. You can negotiate and not get an agreement. You can make a determination that it is a product that will not be negotiated. And
Okay.
there are circumstances where we close a negotiation, but are willing to reopen and it can be a couple of circumstances. One would be a reopening because a product has gone back to CADIF and been reassessed and the recommendation has been changed, or alternatively, that the manufacturer has come back to us with an alternative approach.
Okay, so on that note then, negative, so you've got a negotiate agreement, negotiate non-agreement, and then close. Those are the three aspects I'm looking for. So in the last fiscal year, how many negotiate agreements have you actually completed?
I don't have that detail with me.
We can provide you with that information. We'll look at providing that.
So, and
I was hoping you would have that.
I don't have it broken down by that fiscal year.
good.
She is
She
good.
may
I know.
not
I've
be
heard.
quite that
I've
good.
heard about this woman. I've heard lots about her. I know she's great. Well, yeah, but so.
If I go back and I look at my BlackBerry in a few moments.
So I guess I can't ask you how many negotiate non-agreements you had.
I can say, so what I can say, so if I can do it rolled up, I have some
And I hate to.
information.
This
That's
is like
okay.
rapid because I got 20 minutes. It's
So just
over 2
quickly.
and I got 2 minutes left.
So just quickly, I'll give you some numbers that address that.
Well, how about before you go? I just want you to come back to me sometime. We're going to have 13 hours together. Negotiate
Yes.
with agreement.
Yep.
Last fiscal year, at the
Yep.
least. You could go last couple fiscals,
Okay.
but last fiscal would be appropriate. And then 2017 onwards,
Yep.
negotiate without agreement, and then how many were closed. I kind of just want a list of that because I guess I'll go back to the reason I'm asking is that a lot of folks in the rare disease community, a lot of great new innovative treatments out there on the market. They see other jurisdictions like the United States, European countries have access to a lot of these innovative treatments. And it's this process that gets bogged up with negotiation. And I didn't get into this new acronym that came out, PCODR, I believe it is.
PCODR?
Yeah, another new one for drug, but go with what you were going to say.
So I was just going to say that the information that I do have with me, I will get the information that has been requested. I would just note that the information that dates up to and including 15-16 was that 160 joint negotiations have been completed through the PCPA process, and of those, 11 resulted in no agreement. 42 negotiations were active, which means negotiations are currently underway and have not yet concluded. 23 at this point in time were being considered, which means they were taking into account the advice that has been given with the jurisdictions, and that 63 other brand products had been considered and a decision made not to pursue a negotiation.
See, with those numbers though, I didn't hear any that they've actually been of those. Pardon me? That's how it's pronounced?
No, 160 negotiations had
I know,
been
but-
completed.
Completed.
And so if I go back to the number that I had previously.
Again, that
as an-
negotiated With agreement.
In 16, 17,
Only 11 of those resulted in no agreement.
in no agreement.
160 joint negotiations.
How many
have been
though?
I will give
Yeah,
you.
that's a number I'm looking at.
149.
I think my message here, Minister, is, and I'm sure you're well aware of this, is that, you know, again, we've gone from 167 to 303 on average, let's just say. I know
Yeah.
your numbers perhaps show otherwise. This community sees this process as just a way to stall and delay, and we're talking about people that, you know what, especially, and we're gonna get into OHIP plus next, and I think it has a lot to do with each other.
Mr. Harris, your
That
time
these
is
people
up.
are go without, frankly. So anyways, thank you, Suzanne. I really appreciate you being here, and I'm sure we'll talk to you
We
tomorrow.
now move to the third party, Madame Jolina.